Welcome back to Keeping Up with the Chaldeans. I've got the all-known well, Anthony Toma, my co-host with me. And we are introducing today RN, resident nurse, Faith Jamil, registered nurse.
It sounds better when he said resident.
Yeah. Sorry, registered nurse. And she's part of the cosmetic room that she owns and has a lot of services to offer to the community. And we'd like to welcome you on the show and have you give us a description of what your business is and how you got to that.
So this is Faith Jamil before we get started.
Yes.
Go for it,
Thank
Faith.
you, Anthony.
You're very welcome.
Well, thank you both for having me on the show.
Great to
And
have you.
I am a registered nurse, like Junior just said, and I got into cosmetics about 2.5 years ago. I was doing traditional nursing, worked in a hospital, Henry Ford West Bloomfield, a.k.a. Hotel Henry.
There you go.
And then I moved on to home care. And with home care, actually home care led me to cosmetic nursing, and I'll tell you why. With home care, you're going in, you're seeing the patient, you're in their home, you're taking care of them. And it was a great career, but I got a little burnt out from it. Because you're in the home and you're intimate with these patients, you're seeing a lot and you're seeing how people live. So most of these situations are sad.
Yeah.
And it kind of brought me down. It made me a little depressed and sad. So actually, I went to a wedding and I saw someone that I knew and she looked a little refreshed.
Oh, nice.
All smooth. And so I was asking her, like, what's going on up here? Because it wasn't like that 2 weeks ago.
Yeah.
And she said, I went and got Botox, and I actually went to a nurse. You should look into it. So I started doing some research. And I found, like, the top school in the U.S. is called the National Laser Institute. And I was there in Arizona for about 2 weeks, and I was, like, hands-on. It's a medi-spa. We did class in the morning, and it was, like, inject.
Okay.
Found out I loved it. Came back to Michigan, still doing the home care thing. And I started doing all of this on the side, just for, like, friends and family.
So what did you do? You did the research and you went out and got the stuff to
Yeah,
actually do it?
I was kind of researching LA and New York. You know, it's hot out there, and so what's in, what's not in, and I actually looked into platelet-rich plasma, which is huge.
Say it again.
Platelet-rich plasma.
Platelet-rich plasma.
Yes, and that's a part of your blood. So your blood is made up of red blood cells, white blood cells, and platelets.
Yep.
So you take that out.
So you're talking PRP?
Yes,
you-
PRP.
Oh, why didn't you just say PRP?
I was trying
But
to
you
be
skipped the day in
professional
school when
here.
platelets were
Yeah.
there, bro.
Yeah, right.
Let's say PRP or not, you still need to know what they stand for.
Yes, exactly.
Okay.
Skip day.
Right.
So with platelet-rich plasma, they've been using it in medicine for over 20 years, and they actually started out in orthopedic medicine.
Sure.
So if someone had a fracture or just had surgery, they would take the blood, separate it, and then take that part out and inject it, like let's say in the ankle or the knee.
Okay.
And what that did is it stimulated cell growth
Okay.
and rejuvenation.
Wow.
So in cosmetics, they started using it about 8 years ago. They're like, hey, let's just put it in someone's scalp and see what happens. And it actually stimulated hair growth.
Oh, wow.
Yeah.
That's awesome. It's like amending soil for a plant. You know what I'm saying? It's like you rejuvenate, recharge.
Exactly.
That's good. What got and how many years ago did you get to Arizona? Like when
About
was
2.5 years ago.
Okay. So you just built up the courage and took off and
Yeah, so I started doing this on the side. I was still doing the home care.
Yeah.
And
were
like
you
I
working
said-
for somebody with home care?
I was
Okay.
working for John Paul Home Care, and
Okay.
I actually worked with Jeff Oro from Park Home Care. We were
All
like
right.
a team.
Yeah,
Cool.
great
which
guy.
was great. He
What
was
up,
like
Jeff?
Yeah.
Yeah.
He was my back up because
Yeah.
we can tell you some stories.
Yeah.
But anyway,
Yeah.
so Mr. Rafid Yaldu,
Yeah.
Mr. Humanitarian, he
Yep.
was my boss,
Great guy.
and
Great man.
Patrick and Lance, they were
Yep.
my bosses,
Good
and
guys
it
too,
was a
yep.
great place to work. But like I said, I just got burnt out. I mean, just seeing patients like in their homes.
Sure.
And I'll give you an
Tough, yeah.
example. Like, I used to take care of the Chaldeans at Mother of God Church. And it was sad. So this is my public service announcement to everybody. Go visit the elderly.
Yeah.
They sit in that apartment all day alone. because
how would they
can't
do
leave.
that? How would they visit the elderly? Like, is it
Well,
just
family members. So
your own family members? So what if you just want to do a good deed and volunteer and
you
go
know
see
what? Go. That's great. You should go stop by. They're always just knock on the door. I swear they get so happy. Oh, who are you, Bertamenuet?
Right.
Where are you from? And then they start to reminisce about back home, which is great for their memory.
Sure.
You can also take them meals because they're sitting alone all day.
Do we need
Make
to
sure
reach
they're-
out? Yeah, I was gonna say, do we need to reach out to
We
anybody?
should probably, yeah.
You should reach out.
You can't
Yeah,
just
you
knock
can-
on the door, right? Because where they go rob something? What's they go?
That's
None
true.
of you thugs out there get any ideas.
Those grandmas got people.
Yeah.
They
And,
do.
and pistols.
Yeah,
And pistols.
yeah, some of them.
They do they?
Yeah, heck
Oh,
yeah.
What do
they
you
got
mean? They
pistols.
come from the old
God, I
country.
got out alive. But yeah, you can reach out to the secretary. Just make sure they're not like a diabetic.
Yeah, or allergic to something. Well, yeah,
Right.
you're right.
Exactly. So that was like my typical patient. Like I used to go there, and it was
hard.
sad. Yeah, because
Yeah.
they wouldn't want me to leave.
Well, we're glad you
Mm-hmm.
you brought that up so that people can actually go and visit the elderly.
Volunteer
That's
and
great.
even give a
Yeah,
chance
that's
in on
great.
that.
Mm-hmm.
And I know there's a lot of people in our audience that are going to be happy to do it. And
Yes.
you did a good thing today.
Mm-hmm.
If this bombs, you did a good thing today.
Thank you.
I'm
Thank you. I do want to talk about a couple of things with home
Sure.
care, just because this was my main
Yeah.
experience. I also had a lot of veterans,
Uh-huh.
young, and those were always sad cases. Like I'd get the case, I'd see their injury. They were usually post-surgical, like neck, back surgery.
Right.
Then I'd see they have a VA doctor, okay, and I'd go in and I'm doing my assessment, and you can just tell they're not there. Like they're with you,
Yep.
but they're having like a
The thought
hallucination.
process is not all there.
Yeah, so that was a group that really touched my heart because I'd be sitting with them and I would have to assess, the psychosocial. So like, are you having hallucinations? Yes, I am. What kind? Visual, auditory. Auditory, what are you hearing right now? And it just broke my heart.
What can people do to help?
You know what? Gary Sinise Foundation is great.
Gary Sinise Foundation?
Yes.
We'll
We
post
used
that
to,
in the
my husband and I,
description.
so Jamil, we used to donate to Wounded Warriors, but we kind of found out like their, the upper management was
Taking a little bit too much
yeah.
bonuses.
So we did some research, and the Gary
Yeah.
Sinise Foundation is great because that really goes to the veterans.
Okay.
Yeah, and they all come here. They sacrifice their lives, and they
Yep.
come here, and nobody takes care of them.
Yeah.
So
Yeah,
I
it
just
is
wanted to
definitely.
mention that.
I'm
That's a great
glad
thing.
you did.
Good thing.
Mm-hmm.
So guys, pay attention. If there's an ability that you can help out, we'll post up the link on there for you to maybe give a handout or what have you. But definitely, if you can even visit the ladies, that'd be
Yeah.
a great
Yeah.
move on your part.
Ladies are gentlemen. too. They're-
Yeah, I'm sorry. I'm
Yeah.
sorry, women and men
Yes.
that are elderly, but it'd be great to
Yep.
do so.
And also, sorry, one more.
No, you're good.
The refugees.
Yes.
So I took care of those. That group, I shouldn't say those. That group. And that was also, this is why I got burnt out. That really broke my heart too, just to see them flee. They didn't have a choice, right?
Yes. Yep.
Here in America, 5 of them living in one apartment.
Yeah.
The young ones are sacrificing their schooling, which
Sure.
most of them were in middle school, high school, to work
Yep.
to help support the bills.
Yep.
So if you can, please look into Help Iraq. Reach out to Mr. Yeldu. And there's also other groups within our community.
Calc is good. Chaldeans.
Yes.
So Help Iraq,
Oh,
100% of the donations go to?
Yes.
Yes, it's all
and
transparent.
That's
Adopt
amazing.
a Refugee, Mr. Bacall.
Oh,
Yes.
he's awesome.
And my brother.
We've got him coming on the show, just
Do
so you know.
you?
Yeah, we actually
Great.
invited him on to it. He was pretty ecstatic about getting on.
We'd love to have
Yeah.
Rafit too.
Yeah,
if he
Rafit
has-
too. Yeah, when he
Yes.
gets time. Yeah, he's been a little preoccupied,
Really
but
busy.
we'll get him. We'll get him on too as well.
Yes.
They do a lot of great work. I followed one time with what you're saying. It's a little bit. It's heartfelt. We had adopted a family for Christmas. You have a choice of either just getting the gifts over to them and calling it a day, or visiting them. I wanted one year to go visit them, so a girl I was dating at the time took me on this mission. We gave it a shot, but it's heartbreaking when you got like 5. Like so there was 5 people living in the house. It was a small
Two-bedroom.
duplex style. You know what I'm
Yeah.
saying? And
Yeah, but the joy you brought to them was.
yeah, it's just, but it's
Priceless.
momentary, which is like what you're
Well,
you're
no, it's
saying.
not, because you took the stuff to them, and and they'll use the stuff,
True.
and they won't have to spend spend money on those items, and they'll
it's the continuous though, is what I'm saying. Just trying to find that continuous help. It's tough because when you hear the guy telling you, father telling you, this is where I'm working, what I'm doing just to survive. You're like, man, I can't. Like, what can I do? I want to give him a job. You know what I'm saying?
Do more, of course, but obviously they're blessed to be in this country.
They are. They are, and they
versus
appreciate
war-torn countries that they come from. Yeah,
but they also didn't have a choice.
Yes.
They had to leave.
That's
agreed.
Of course, agreed.
That probably meant so much to that family to show that you cared enough to go there and see them and meet them.
And they got a chance to hug you and kiss you.
Yep.
And,
and
tell you how much they appreciate it. It's awesome.
It definitely did help. Well, so that gave you the warmth and stuff. You took care of people, got a little burned out because
I got depressed.
I was going to say, it breaks your heart.
Yes, because I started to worry about my patients. Like if I had to send a patient to the emergency room, call EMS on the, I call and follow up and they're not answering, they're not home. Like it just kind of brought me down. So I needed something fun to do.
Yeah.
I'm like Botox and fillers.
Well, you're still helping people in a way.
Yeah,
with the services that I see that you're offering. Still makes sense. You're still dealing, because at the end of the day, my self-esteem might be down.
Yes,
and
that's
a little
the best part.
Spruce me up, clean me up, make me look 5 years, 10 years younger, or whatever it may be, But you're still helping people in an indirect way.
Exactly. They come in, something about their face really bothers them. Like if they've had a lot of weight loss, that whole sunken look.
Yeah.
I'll fill it to make.
My face is full because I haven't had any weight loss in a while.
I'll be going through that soon. I need a little weight loss.
Right.
I'll be with you.
If you've been watching the shows,
in our lives.
Everyone needs a little Lena Dabish in their life, right? Or Bahri.
Love her.
Yep.
Love her.
So
they come in, this is really bothering me. And my signature is natural. Like I correct more than enhance.
Right.
Okay.
Oh, nice.
So if I see something that's a little off or asymmetrical, I'll fix it. And then at that point, if they want to enhance it, we can do that.
Got you.
Yeah.
So
So you give them a chance to look normal.
Right, I was going to say.
Normal. I don't want to use the word normal,
right,
but
I get
refresh.
It, but, refresh.
So let's throw this out there. Sometimes I sit at the doctor's office, just for when you go through your regular physicals and stuff, and then I'll start talking about from a guy or a woman, the first crease comes in like center here, then it goes to 2 creases, and it's
11.
this, and then so they were
from a 1 to 11.
11?
Yeah.
Oh, 2.
2.
Yeah.
2 looks like an 11, right?
I don't want to assess you guys on.
No,
you should.
It's okay. You can. Tell us. Like, I mean, I think I got the 1.
So you have like 1.5.
Okay, 1.5.
You have a 1.
6. Oh.
Yep.
You said 6.
3 6s.
Yeah. 6.
No.
I have a 1.
You have a 1.
Okay.
Anthony 6'9".
I'm just
Got to
talking
have the
this
triples.
area. Oh.
Yeah, Takashi. I know we don't want. We don't want the
That's a tattoo.
6s.
That was a tattoo.
Yeah, we don't want that. So right now, does that come from like just aging, or does it also come from aging and me squinting as I'm also driving and the sun's hitting me? And you ever notice that? That's why sometimes I'll put my sunglasses on.
You scowl.
Yeah.
Also, I've used like Neutrogena, like soap on my face, facial wash, and then
it tightens it up.
Like a 30 moisturizer on my face for ever since I was 19 years old.
I do aloe vera. I actually take aloe vera gel, not the juice, so people don't get it confused.
Well, you know all of that shit. I just buy off the shelf.
Yeah.
Since you're knowledgeable in a certain area.
He knows.
CBD Cosmetics.
Yeah.
Is that coming out? What's up with that?
Yeah, they're working on it. I know a lady from LA contacted a friend of ours from here that deals with a lot of like beeswax and stuff because it's more natural.
Yes.
So they want to work it and incorporate that. The whole point of CBD is that it works inflammation and other properties that's from healing and other things. Like if you have like lesions and stuff like that too, you can work that onto it. Because today's market, full spectrum CBD or just CBD is incorporated in shea butter and stuff like that. So whether I have like skin cancer or if I have stuff that is there, you're able to use it. So technically, yeah.
Yeah, because a lot of women come in with like rosacea, hyperpigmentation.
Yeah.
I haven't really found a product. I found one product that I like, and it's actually made from snail serum.
Okay.
But I've been wanting to research the CBD field.
Further it, but just be careful. You have to know where the source comes from.
Okay.
Because certain is not true. There's true hemp, and then there's CBD with a little bit of THC ratio. So you just have to research it. I can get you a book on that if you just want to see something. And again, I walk into salons, whether it's Fayez's salon or whoever's salon, they have CBD products that are sitting on their counters now.
Awesome.
Yeah, so I would definitely, even the girls that were here from, Tanya and them from their salon too.
They carry
yeah, aesthetics. Yeah,
CBD.
they carry as well too, some of the stuff. So I would definitely get into it. Just be careful what you're not, and we'll help you with some
It's
of
like
that.
olive oil. You don't know if it's the pure olive oil
Sure.
or if it's fake.
Correct.
Fake olive oil.
You're 100% right.
Yeah.
Yeah,
Just
especially
like
right now.
fake Botox.
Well, you're
Let's
right.
talk about that.
Yeah.
There's
Well,
fake Botox
yeah,
out there?
Yeah. So
Yeah, but if somebody's going to someone,
that's the
they're
thing.
injecting fake Botox?
So they go to people like out of their basement, their hairdresser, who's not a medical professional.
Sure.
So these people are getting it from like China,
Yeah.
Jordan.
That's the
we
same
don't
when we
know.
talk about CBDs. It's
Yeah.
the same
Yeah.
thing.
It's also fillers.
Yeah.
I've heard so many like nightmare stories. I've had people sit in my chair with
Sure.
silicone in their lips.
Do you need it to be certified?
You need to be a registered nurse, a nurse practitioner.
To apply
Yes,
Botox?
because it's a medication.
Oh.
So let's go into that as if you can help me
Yeah, so,
understand this.
people need to come to you, to a registered nurse, to be safe about it.
Well,
Exactly.
that's one thing, and then the second thing that I have heard it can be used in both. If you can explain, I can use Botox to whether it be fixing my 1.5, or I've also heard it work for migraines. Is that
Yes.
something that you
So
do, or
there's-
how does that work?
There's cosmetic purposes for Botox, which is what I do. I
Okay.
relax wrinkles.
Okay.
Okay, and I give you a refreshed look. And then
Sure.
there's a medical aspect. So,
Are you able to do the both, or just one or the other?
I can, but I prefer not to.
Sure.
Like, I
Okay.
feel like I've had people reach out to me for migraine
Yeah.
use. I'm like, go to your neurologist. That's
Yeah.
their specialty.
Okay.
They also use it with athletes. So if they have like a tight muscle,
Yep.
we saw him,
We saw
Yeah.
AKA Steve.
Yeah.
If they have a tight muscle, they'll inject Botox. People who are cross-eyed
Yeah.
or have a lazy eye, they'll
Yep.
inject Botox.
And
Bladder
what is it?
dysfunction.
So
Yeah.
my daughter has a lazy eye.
Okay.
It's not visible, but
Uh-huh.
it doesn't function as
So
strong
when
as it
sometimes when
needs.
she turns left to right, sometimes it'll
No,
stand
she just
still.
needs a
and-
patch. She needs to wear a
To
patch.
strengthen the
Yeah,
muscle.
so what is the Botox there? Like, how would the Botox
They
help
wouldn't
her
use
vision?
well, they wouldn't use it now, but what it does, Botox relaxes the muscle. So if it's pulling on that eye, they put a little bit in
Gotcha.
to relax it.
And then what about
Yeah.
like underarm perspiration?
Oh,
They
yes.
use that too, right?
Yep, and
It does?
the palms. Yep.
Palms,
So
yeah.
when you inject Botox, it you don't sweat in that area as much.
Oh, really?
But what people don't know is your body has to release a certain amount
Right,
of high
so-
fluid.
Yeah.
So if you're not releasing it here, you might release it in your feet later on,
Oh, okay,
or
okay.
your forehead.
That's what I'm
But
telling
some
you.
people don't care, like the professionals.
Yeah.
They want it done under here
Yep.
because they're wearing
Right.
Yeah.
white shirts
Yep.
or whatever,
Yep.
and they don't want it to show.
No worry about
Yeah.
the rest of it.
Well, that's me. Like,
Yeah.
because a lot of times people know me. I'm still wearing long sleeve shirts in the summertime. You know what I'm saying? And man, whether it's winter or summertime, it is definitely. So, like, if I did that, the repercussion would be, okay, worst case, I'm sweating it through my feet or
Right.
whatever it may be, or I'm running it down my brow. Okay.
Exactly.
I got you.
So give us a rundown of your services that
Yeah.
you have to offer.
Okay, so I have filler services. Let's start with that.
What's a filler service?
Fillers folds or lines
Oh,
and
okay.
enhance. So, for example, if someone's lost weight and they need their cheek back, we have a filler for that. That's called Voluma.
That's this right here?
Yep.
Okay.
I just wanted to say that a lot of people reach out to me and they say, how much is your filler? Well, one, you need a consultation. You need to know what area we want to treat, what kind of look you're going for. So it's always best to start with a consultation.
Do some people have already had the consultation with someone else and know what kind of filler they want? Or maybe they're just shopping around.
They're shopping around, or that medical professional didn't take the time to educate them and they're just trying to make the sale. So I've had a girl reach out to me for cheek filler, and these fillers work differently.
Okay.
And the cheek filler is a 24-month cheek filler. It lasts for 20
wow.
more months, and it's more expensive. So she told me, well, a doctor was going to use Ultra, and why can't you just use that? I'm like, well, one, it's not appropriate for that area, and two, the duration is not going to last as long. So it's important to educate the client on the different products that you have.
And if you're going to put something in your face, you shouldn't try to be cheap about it.
Yeah,
Well,
don't
Jeez.
discount your face.
That's
Yeah.
perfect. You brought that point.
That's
up.
crazy.
Let's talk about that for a second. when we're talking fillers and all that stuff, it's not just lips and cheeks.
Yeah.
You got
Yeah.
the rear too, right? I'm serious. Like, isn't that what a filler
You
is?
can put filler anywhere.
Yeah, that's what I'm saying.
There's
So-
But
different
wasn't it
products.
in your butt?
Yes.
Isn't there like implants though?
Yes,
You can do implants.
both, but
Or you can do filler.
fillers.
Filler or
How much
collagen.
filler? 10 pounds?
A lot of
A
filler.
lot of filler, and I was just going to talk about that because a video surfaced the other day, and they were showing some guy draining the filler out of her buttocks
But
Oh.
because
are you
it wa-
sure it was filler and not like silicone or something else?
it said like fill too much, like it was like that
Oh.
was that but it was on WorldStar, but any of that. Well,
Who's
there's
Phil? What's that?
No, it
I've
was
never
on-
seen Phil.
no filler.
Oh, yeah, okay. I'm just kidding.
He filled. Ha 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 ha. So, but again, doing that like you said the cheap way, there's still
Yes.
risks.
Oh my God.
So
That's
you're
insane.
This is what people don't understand. Another public service announcement.
Yeah.
Thank you.
Go to a medical professional. Don't
Right.
go to your hairdresser. Don't
Yeah.
go to someone's basement, okay? Because you don't know what they're injecting
Yeah.
into your body. These things will react.
Yes.
your body.
It's your body
Eventually.
or leak or any
Yes.
of that stuff.
And not just that. If they're using a real filler,
Sure.
we have. I'm going to use.
Yeah,
Sam,
let's talk about. Hey,
Steve.
Wissam, how are
yeah,
you?
Wissam. We have a lot of arteries and vessels, and this is not even showing you exactly how much we truly have. This is just the surface.
Mm-hmm.
And if someone gets a filler into a vessel,
Yeah.
that can cause blindness.
Oh, Jesus.
Oh wow.
Yes. It can cause your skin to basically go necrotic. And so the professional has to, we're not perfect here.
Mm-hmm.
You know, we don't have x-ray vision. The professional needs to know what to do in those emergency situations.
Okay.
And most of these people don't know what to do, and they don't even know how to assess for it. That's the thing.
That's crazy.
So as
just
I-
to save a few bucks.
Yeah.
I think these services are not cheap.
Right.
You know,
But just your body. It's
Or
not
maybe
supposed
it's
to
not
be
to
cheap.
save a few bucks. Maybe it's that their friend is doing it, and they're like, "Oh, let me support my friend," not knowing that that person needs to be
Licensed or
certified
proper. Yeah,
somehow or
certified and
licensed.
licensed.
Yeah. So if you're out there doing it in your basement, stop that.
no.
Yeah.
They won't.
we're gonna
and that's
find
the
you.
thing.
And
Yeah.
get you.
Yeah.
Eventually something will happen and
Yeah.
you will go down. And
Yeah, that's not good. You're messing with
No.
somebody's body.
Yeah. Life.
Yeah. Well, yeah. If
Yeah.
you're talking about going blind and stuff like that, you're right.
Yeah.
Insane.
It
That's a
is.
change, of course.
It's a risk, but it's not a high risk. It's like 1 out of like 17,000.
Sure.
So, you know, but you just have to know who
But
you're
if you
going
don't
to.
know what you're doing, the risk is higher.
Oh, yeah. Yeah.
So what's this pen we have here?
Okay, so that is our micro pen. It is used for collagen induction therapy. Also, people know it as a vampire facial or micro needling.
Mm-hmm.
And what that does is it has 12 tiny needles. So what I do is I numb your face and I basically break down all of your skin.
Ooh.
And that just tells your body, like, hey, go to that area that we just injured and heal it and refresh it all. So it's great for people.
Okay.
Do you have a question?
Yeah, I was going to
Yeah.
ask you, how far from microdermabrasion is that?
Okay.
Or is that?
Microdermabrasion is more surface. This goes
Okay.
deeper. But you have to know, once again, who you're going to, because if
Yeah.
the person goes too deep, that can leave you with hyperpigmentation and scarring.
Okay.
So,
Which is what looks like more darker blotches on my
yes.
face and stuff.
I've
Yeah, okay.
had a lot of women after pregnancy, they get melasma, you know
Yep.
what that is?
Yep.
And they go to someone that wasn't qualified and they went too deep to get that bloody
Yep.
effect.
Yep.
And their melasma got worse. So, and nobody wants that.
Sure.
But that is great for melasma.
Isn't women inherit
Mm-hmm.
that after 40, don't they? Or no, isn't it something similar that women inherit where you get the blotches of color to the skin?
It might be the melasma, that
Okay.
the
Yep,
hyperpigmentation.
yep, okay.
Yeah, because it has to do with like hormones.
Yep.
And,
Yep, that's exactly. Okay.
But that's great for acne scarring,
Mm-hmm.
texture, tone, blackheads, pores,
Really?
fine lines. So it's great for men and women.
Yeah, yeah.
Mm-hmm.
Yeah, I got to come see you. I got a few blackheads.
Go
Sorry.
ahead. No, go ahead.
That one you can use hyaluronic acid, or I can draw your blood, which
Mm-hmm.
is that kit right over there. I separate the blood and
That's
I take
this right
it.
here, right?
Eclipse
Yep.
PRP.
Yep. And I
Okay.
take out the platelets, and then as I'm creating the channels with the pen,
Yep.
we put the platelets back in and we kind of push it in, and that stimulates growth.
Okay.
This is serious lab stuff,
Yeah.
huh?
Oh, yeah.
Yeah, I'm just thinking right now. She's talking to me. My head is envisioning me sitting there just getting
Yeah.
Am I going to handle it? Time-wise, what does that take? Like, is that
About
like
an hour.
And how often is it repeated, the process?
Okay, so we recommend 3 treatments.
Sure.
And then a month apart.
Roughly,
And
what
then
does something like that cost for
That's
some?
the hyaluronic acid is about 300. The platelet
Yep.
is about 500.
Okay, and that would cover the 3 sessions in, or is
No,
that
no,
per
per
session?
per-
Okay,
per
it's good to know.
session.
Yep, it's good to know. But again,
So for $300, you can look like Kim Kardashian if they come to you, right?
no, you got to be the 3 plus the 5.
Right. All of
and then
that stuff.
More than just 3 treatments.
And you have to
Yeah.
have a surgeon.
Yeah.
Yeah.
Let's be real here.
And Kanye's money and her money.
Yeah.
Oh yeah.
Yeah, there's a lot of.
By the way, I noticed you always reference Kylie. What's up with
Kylie
you?
Jenner?
Yeah.
She's rich.
but you always
So who's
tag
I
her.
your-
think I said
Yeah,
Kim,
you
though. I
done-
think I said Kim this time.
You said both.
Who do you think is the prettiest?
Of the Kardashian women, the prettiest, probably
Chloe.
Caitlyn. No, I
So
would say
That
my
was the
next post, I have a great post.
That was
Alright.
great.
I'm going to tag you on that one. I have a
Alright,
great
cool.
one
Man.
of Caitlyn.
awesome. No, I think the
Caitlyn.
best looking one, probably Kendall.
She's beautiful.
Yeah, she's gorgeous.
Yeah.
She looks as natural as can be.
She started to do some work, but
She
it
did?
looks good.
You could tell?
Yeah.
Yeah, they have
See, I
to.
can't
So
tell.
it's going to keep them going for a long time.
Yeah.
Yeah, and
Fine.
you know what? If it wasn't for them, I think people wouldn't be
Unconscious.
Yeah, they wouldn't
Yeah.
be. As soon as Kylie did her lips, everyone wants
Listen,
lips.
Yeah.
they changed
That's
a
good
couple
for you.
things in society. They made more interracial marriages acceptable, and they made beauty a different level.
Yeah, even within our community.
Yeah, even
Yeah.
within our community.
So.
Both.
And interracial divorces.
And interracial divorces.
Yeah.
Yes.
Oh yeah. Oh
More
yeah.
acceptable.
Yeah. Yes, agreed. So next up with that pen, I see you have stuff that helps men with hair regrowth, stimulation. Talk to us a little bit about that, because you've seen a lot of guys, I'm sure, in our community have traveled abroad to try to get things done. with
Turkey?
Yeah,
Yeah.
Turkey and a few places.
Canada. Did you hear about that?
Yeah, I've heard some of the
Woo!
nightmares too already.
So I see a lot of the guys are benefiting from it. Like I haven't seen like too many horror stories. I heard a couple here and there.
He's
But
talking about the transplants.
yeah,
Yeah.
That's what I'm talking
well,
about too.
no, the
No, there's been
Canada
some-
one.
yeah, some
I
was
had
that
a
a
guy call me
debacle?
and say,
That guy was doing
I'm
dirty work. Well, he was.
Oh, was he?
HIV.
Yeah.
He was using the same instruments
Over
on
and over.
the patients.
Oh, geez.
Yeah.
Some guys, like, I
yeah.
had to go get tested for HIV. I'm like, oh my God, please don't tell me this right now.
How much does it cost to sterilize?
That's what I don't understand. You know
it's-
what? They did it cheaper over there.
Yeah,
Well, you
but
get
by
what
a
you
few
pay
thousand.
for,
How much is-
people.
Jeez, yeah, be
that's
careful,
back to
man.
what we're saying. So somebody wants to avoid that, they come to you.
Yeah, I mean, there's
So
blood
when they-
going on.
Yeah, you
Yeah.
have to even
Yeah.
with that pen, you have to be very clean. Like
Yeah.
I use like
That's like a tattoo
hospital
pen
grade.
almost.
Yes, the backflow of the
Yeah, because
blood.
you're
I
in
don't
the
want to be
lab, you're at
spreading
your
that.
office. You have
Yes.
all of the
Anything with that
equipment.
stuff, I mean, any of that stuff, you always have to be careful with, especially medically dealing with it.
Yeah.
Where are you located?
Yeah.
Maple and Orchard Lake in West Bloomfield.
Oh wow.
Okay.
Great
Where?
location.
Yeah. What
plaza?
mall?
I'm
Plaza?
in the Tambark buildings.
Oh,
So
yeah.
that's the reason why I chose that. I started off in a salon.
Yeah. Tambark
Great.
is 2 doors down from the Asian place.
Yes. what is
Nara.
it? Yes.
Yep. 2 doors down
Right
from
across
Nara is
Plum.
Tambark.
Oh.
Yep. So if you're looking at Prime 29 standing in the patio, you see her office
Exactly.
right across the street.
That's how I describe it.
If you're doing what?
If you're standing outside the patio of Prime 29 on Maple, you look across, you'll see Tambark offices right
Nara's.
there.
So if you're looking across Nara's. To the
Nara's
Nara's
in
there
front of me.
and then-
Nara's to my left. She'd be to my right.
Oh, okay.
If I'm
okay.
looking across
Yeah.
from the
All right.
patio.
So
Yep.
so the
I used to be there. I had an office
The-
over there. My brother Omar
the
did too for a long
northeast
time.
corner before Nara.
Yep. I started
Gotcha.
off at Blush Salon. Well, I didn't start off at Blush Salon. That was a place that I was at.
With Pauline? Or
Oh,
Paul?
no, Lena.
Oh, I'm sorry, with Lena.
Yeah,
My
shout
apologies.
out to Lena.
Pauline was with Lena too for a
Yes.
while. Yep. Yep. Shout out to Lena too.
She
She's
was
married to a
great.
friend of mine, Mark
Yeah.
Sadik. Yep.
So when we first started out, she's like,
Mark's
I
good
do
people,
Botox.
man.
Yeah.
Yeah.
She's like, I do Botox. I'm like, I do Botox
Yeah.
too. Like, we didn't care. But then, we realized, like, people are very private about it
Sure.
still. So I had to find a location that was private, more like a medical office setting. So that's why I'm there. And
That's a good idea.
Yeah. And HIPAA is very important to me. Like, I even spread out my appointments where it's like 15 minutes in between because I just don't want patients seeing other patients. So
Okay.
the privacy is very
Well,
important.
when they walk in, they'll recognize them. When they walk out, they won't anyway.
Because you made them so beautiful, right? Yeah.
No, not necessarily. Not in the beginning when you're swollen and red and bumps everywhere. Yeah.
Nice.
So for the men, if we talk about that, I come see you. What benefits do we get, like with the hair regrowth and what have you? Like how many sessions or what exactly does it entail, just to kind of...
So first thing is consult. If I don't think it's going to work, I will tell you it's not going to work. You need to go get a transplant.
Okay.
You have to have some hair.
Let's just say I came to you. I'm receding a little bit. I mean, it comes with age. I'm not losing much. I mean, as you can tell, but it's the receding. Is that something you'd be able to help to get some of
Because you
this?
have a little fuzz here, it could grow
Stimulate
in,
and come back.
but it would for sure prevent hair loss.
Okay.
So that's a great thing.
Okay.
The minimum it would do is prevent further hair loss.
On there. Okay.
But it does thicken the area if there's hair growth. So that's why it's important to do a consultation.
So if people wanted to find out more information about you and your services besides watching this, where else would they go?
They can just reach out to me and come in for a 15-minute consultation.
Yeah, but so where would they do that? Like they go to Facebook, Instagram,
and Facebook.
Instagram, Facebook.
Cool.
And what are your handles there on Facebook and Instagram? Like what's the... It's Nurse Faith or Faith?
They can type in my name, Faith Jamil.
Okay.
Or they can go to my business page, the Cosmetic Room.
Cool.
Okay.
And she's Cosmetic Nurse Faith on Instagram, too. You had a cool little giveaway you were doing. We'll get into that in a second. So one question that I have is who was that important, or who were the important people who are the important people that played that role in your life to push you to this, to start doing this service and having this business?
My family, because it's so hard going from being a nurse, being told what to do, like doctors write the orders and they just tell you what to do, to being your own
facilitator.
Boss. Yeah. So that was a big challenge. I was afraid to do it, take that risk, but everyone kept pushing me because I have the talent to work with fillers and Botox. But my medical director, Dr. Talia, he's out of Henry Ford, West Bloomfield. So if you ever end up in the ER or have a family member, just ask for him. He told me, Qalat. He's
Chaldean.
He has no bedside manner, okay? That's why he's not allowed in my studio.
Oh, boy.
He's like, listen, you fail. Who cares? The worst thing that's going to happen is you're going to go back to being a regular nurse. Just do it already. So he's my business partner and my boss.
Awesome.
So he kind of pushed me to do it.
Great work, Dr. Talia.
Yeah.
Great work. We grew up with him, so I know him pretty well.
Yeah. Sorry.
Good guy. Always.
Also my husband, he said, you know what, just go for it. If you fail, it's okay. Just, what's that saying? Like, go down with the fight, or, don't give up.
So we're going to have Sid on the show
at
a later date. Why don't you just plug him while we're here?
All right. Sid Jamil, a.k.a. home run hitter.
Yeah, he's smoked me a few times.
The older gen knows him more than the younger gen. But actually, the younger guys were like, oh, my God, I used to go to the softball games and watch him hit home runs.
Yeah, used to smash him.
Oh, yeah.
Yeah.
I used to be afraid to pitch to him because it was...
Oh, you were the pitcher?
Yeah. Not because he hit a home run. That's okay. Hit a home run, but don't hit me.
Yeah. He was
coming right
I started wearing a mask.
But you know what the funny thing is? When I started dating him, he was not that good. And he told me, I was the curse.
Probably the Botox.
Yeah, the Botox.
She injected it in his arm.
Not at Adam.
I'm saying she injected it in his arm.
Sabotage.
So anyone that needs to hit home runs, go see Nurse Faith. She'll make you hit home runs.
Yes. So
that's funny. So what does Sid do?
Yeah.
He is a financial advisor and a realtor. He works out of Birmingham, Keller Williams domain.
Good.
And from what I understand, every sale he makes, he makes.
Yes, he donates
cool
3% right off the top, not after he pays everyone.
Yep.
And he has 3 foundations that he supports, which is Help Iraq, the Gary Sinise, and Humane Society.
Oh, that's amazing.
Yeah, because he loves animals.
Yeah. Yeah, that's amazing.
And you have a Blaze in the house?
I have a Blaze.
And we have a Blaze in the house.
And I have a Roman and a Lourdes. So Roman is 9.5, and he thinks like the generation of YouTubers.
Yeah.
He thinks I'm like a celebrity.
Yeah.
And like,
well, you
people
are.
know me.
You are.
So I want to shout out to him,
Yeah.
but like he'll be out with like Sid, and they'll be like, "Oh, I know your mom, Nurse Faith," and he's like, "Mom, you're a celebrity. Like everybody knows knows
How
you.
cool is that?
Yeah.
My mom was known because of dirty jokes, so
Oh.
it's a little
Really?
different. Yeah, we know your mom. She does a dirty joke.
Ooh.
That's
but
hilarious.
yeah, she was hilarious for that. So it's good.
Yeah.
At least the next generation is YouTube.
Do you guys have keep those jokes going?
Omar does.
Omar, of
You
course.
gotta
Omar
write 'em
does.
down,
Omar does. Oh,
write
what do you
'em
mean?
all
If it's
down.
not them, it's somebody who will DM and say an old schooler. Like I even got one the other day. I posted something from our stuff, and she's like, "Wow, great work." She's like, "I'm so and so's aunt from this side here."
Oh,
and it's
no
like your
way.
mom was the great at cracking jokes. I'm
That's
like,
awesome.
okay, give me one. Let me hear it. You know.
Right.
So.
Do you have a famous one?
Oh, I can't.
You can't when you
She
can't
they were
say
so
it.
dirty. Yeah, there's some of the stuff that shoots. Yeah,
Come on, Junior, let's have some fun.
Can you edit it and
Yeah,
you substitute
I'll
the words?
I'll do one. I'll get one together on another show, and I
Okay.
promise I'll put it out there. At least
All
one
right.
ending to it.
Cool.
Any tips you want to give to any of the younger generation that is coming up? You know, you're seeing like you have kids that are 9 and what have you, but we want to have you influence them because there could be another nurse Faith that would come up, and you know,
people that are out there
Yeah.
that were in the situation or the state of mind that you were in before the doctor pushed you into.
Yep.
You know
push
what?
them, give them a
Yeah.
little push so that
Yeah.
they know what you went through and what didn't stop you from your dream.
Basically, don't let your fear and anxiety get the best of you. Just
Sure.
push through it, get through it. Expect challenges, expect some failures, right, guys? I
Sure.
mean,
Yeah.
you guys
Yeah.
have been.
Plenty of
Yeah,
them.
Yeah.
we're failures. Thanks.
Yeah.
And
Thanks,
if
Nurse
you're,
Faith.
yep. I didn't mean it like that. I'm sure you've had some businesses that went.
Million of them.
Yeah.
Yes.
So
Yeah.
just stay focused, persistent, and dedicated, and where you want to go. So
Awesome.
that's really important.
Unless if you want to give a shout out to anybody, whether it be the industry or again friends, family, if you want to just let anybody know.
Okay. Shout
Thinking
out
of
to
it.
my husband, my biggest supporter, my
Big city.
family and in-laws, and Roman, Lourdes, and Blaze.
Yay.
Beautiful.
And also my mom. I have to shout her out. She supported me from
Mamas
day
get a lot of
one.
love on this
Yep.
show.
I also want to shout out to the younger nurses
Yeah.
that are up and coming. Before, back home, when I first went into nursing, my mom's like, no, that's
Yeah.
like frowned upon. You can't
Yeah.
do that back home, right?
Really?
Yeah, they said it's like
didn't know that.
inappropriate to see like someone naked or whatever.
It's different. Like
Yeah,
if the-
it's
you know what I'm
different
saying?
now.
Yeah. They,
Oh, yeah,
They
no,
secluded
no.
us from a lot
Yeah,
back
yeah.
in the
They
days.
did.
Yeah.
So good for you guys. And if you ever need any help or advice, feel free to reach out to me. I love helping people.
Awesome.
Well, get to, DM the professional. She's
Yep.
giving you the free courtesy of reaching out. Cosmetic Nurse Faith at Instagram, and you want to give us a little intro on the giveaway or what you want to talk about
All
that right
right.
now? Or unless there's anything we skipped that you want to maybe let anybody know of anything here or
Do you have
Yeah.
any questions about the products?
no,
or-
but I might have to see you though.
Yeah.
This or the blackhead, one or the other.
Yeah.
Something's got to hit. So,
I'll hook you up.
Before we
don't
get to an 11.
yeah, before I'm one and a
One and a
half.
half.
So
I'm
actually,
one and a half, baby.
She threatened us with Botox.
Well, yes.
I know I was
Before.
afraid to bring
Yes.
And
that.
I was
I'm
I was a little nervous coming in today.
Yeah, I was gonna nominate you for it. I was gonna say,
I was like,
He
Brooke-
nominated you.
Yeah.
I'm like,
I was
this
like,
is not
Brooke,
gonna
where
go well.
shouldn't she put the needle in my face? Where should I?
Have you guys ever had Botox?
No.
no, never. I've never done anything. The only thing I've ever
Really?
done is I've done a
Facial. Or
facial.
something.
Yeah, facial. There's
Didn't it feel nice after?
great. I mean, what do you mean? It felt great. It's
Mm-hmm.
my only problem is why I don't go back to her. Truth is, I'm worried about passing out and snoring.
Oh my.
While she's working, because you know how relaxing it is, right?
Yeah.
Yeah, and I'm just worried about the, you know what I'm saying? She's gonna.
It happens during the
Scare
sauces
the
all
hell out of
time.
me.
Yeah.
Yeah.
So I.
She'll be like, ooh.
Yeah. He's loud.
Yeah.
Don't come back.
Mm-hmm.
So yeah, but that's the only thing I've ever done. But no, never any Botox or anything. I've used that C-Lax or that C serum or whatever that you can that tightens up your skin.
Yeah. How did that work for you?
It irritated me. It
Yeah.
sometimes would burn a little bit if I ever did that here or what have you, because that's where usually your forehead as a man, they say, because you do a lot of squinting and stuff, it burned. And then sometimes I'd get like a bad reaction, like,
Because it causes inflammation to
Yeah,
plump it up.
yeah,
So
that's-
you
that's-
kind of don't want that.
no. So I stopped it.
People
so.
are afraid of Botox. They're afraid of looking like frozen.
Yeah.
I can't
That's
move.
what I was
But-
afraid of.
yeah.
Like today coming in, I thought I was going to be leaving.
No,
No,
I,
like Simon
I've seen some
Cowell.
people that look like their eyes just changed
Yeah,
a little
they're
bit.
like this.
Yeah.
Hi, how are
Yeah,
you?
yeah.
No, there's a natural way to do it. And it
Okay.
just
Okay.
gives you a great refresher.
I'm glad you brought that up.
Cool.
That was a good point.
So what about this giveaway?
All right. So my niece, generation of app for everything.
Mm-hmm.
She did the giveaway through an app. Sorry, got to take out my phone.
Don't worry, you're okay.
And I have the winners here. So I feel like I need
Winners as in plural?
Yes.
Oh, wow.
Because there's different. She's got different services.
All right,
They
let's do
got
it.
to enter for whatever they wanted. I feel like I need like a drum roll or something. Okay.
Yeah, let's
So
do
the
it.
winner of the PRP Vampire Facial is Rebecca AR.
Hey, Rebecca.
All right, Rebecca, got yourself a nice facial.
Yeah. And then the winner of the Botox is Amanda Hermes.
Oh, Amanda
Awesome.
wins.
Yeah, Amanda.
Congrats.
She's a great person, by the way.
And lastly, I was really surprised that this person entered for a filler, for lip filler, but hey, Junior Binno.
No.
No, I'm just kidding.
Are you kidding me?
Hey.
I don't think I need them.
Can't wait to see you.
Oh, right.
gotta do it before
What do you
and
mean,
after, Junior.
I'll come back. Yeah, you ain't lying. What do you mean? With duck face, man, coming out. I might be.
Quack, quack.
Yeah.
No, I'm kidding. It's Alicia Kanaya.
Alicia.
Awesome.
Yeah.
Hey,
All right.
congratulations.
Congrats.
to all the
So,
winners.
I'll reach out to you guys, and hopefully we'll see you soon.
Cool.
Yeah.
Cool.
Well,
Anything?
thanks.
Yeah, I was saying it was
Thanks for
awesome. It
coming
was
on.
really,
You
really
did
awesome
great.
having you.
See, it was painless, right?
Yeah.
Yeah,
Was,
I guess.
I guess.
you got anybody?
I could have used an extra shot.
Yeah. Well,
Is that on camera?
shot of Kettle One helped, yeah.
Do
Yeah.
Besides Sid, anybody else you want to see on the show? You want to give him a shout out to
You
get
know
him
who I
on?
would love to
Yeah,
see?
tell them we want to tell them.
Bishop Francis.
Ooh.
Come on, just go
We're
on.
dying to get him.
I
We might have to go
wish.
with
I love
we might have
him.
to go with the second in command at right now because
Who's
they
the
may.
second in command?
I got to see. I mean, you would know more.
I don't
I know. My brother was telling me there's Father Pierre. You want to maybe get on? We talked to Steve
the
Mansour. Was
new one, the new kid. The guy with the deep voice. I should know
I'm not-
my priest's name.
Steve Mansour mentioned somebody
Yeah.
too.
Hold on.
forgot
What's
which
his
one.
name?
Father
Starts with a P, I
Father
think.
Anthony, Father John, Father Matthew.
Yeah.
No. He's a bigger. I'm not saying bigger, but
Yeah. I'm not sure.
don't know. We'll
But
figure it out.
we got to get
We'll
one of
figure it
them
out.
on here.
Yeah.
Definitely. They got to let
Cool.
the people know. So.
All right, well, thanks again.
Cool.
Thank you.
This was
Awesome
awesome.
having you. Thank you.
Glad it's over.
See you guys next time.
All right.